standard precautions in healthcare. These are set of infection control practices. It is based on the assumption that all secretions may contain transmissible pathogens irrespective of the diagnosis. These are the basic level of infection control measures. The key components of standard precautions are handy PPE stops respiratory infection efficiently. So this is a mnemonic you can remember for this. Hand hygiene includes hand washing, hand rub, hand scrub. Hand washing meaning it takes around 40 to 60 seconds. You wet your hands and apply soap, rinse well and dry thoroughly with a towel. Using the same towel, you close the tap. Hand rub meaning it takes around 20 to 30 seconds, which is half of hand washing time. Here you use a alcohol based rub in all the areas and rub the hands until it becomes dry. Hand scrub meaning it is done before surgeries. If it is the first wash of the day, meaning before the first surgery, you take around 5 minutes to wash your hands properly. In between the operations, if you are doing hand scrubbing, it takes around 2 to 3 minutes. Indications for hand hygiene are before and after touching the patient, you need to follow this hand hygiene practices before any aseptic procedure. Also, after touching the patient surroundings, environment, you need to wash your hands. After body fluid exposure risk, also, you need to follow hand hygiene practices. PPE is nothing but personal protective equipment. It includes gloves, gown, mask, goggles, face shield, and this actually protects the healthcare, his skin, mucous membrane, clothing, and airways. For example, during COVID, everybody was wearing PPE so that they protect their airways. We don't get COVID via the respiratory tract. And these PPE is mainly worn whenever you are expecting some body fluid or blood splashes are expected. That is when you wear this. For example, OGCians before delivery, if we expect the amniotic fluid splash during labor, right? So they wear PPEs. Safe injection practices are after an injection, dispose the needles immediately after use. Okay, do not keep it on any surfaces or do not try to recap the needles and never reuse the needles for patients. Respiratory hygiene or cough etiquette meaning when a patient has symptoms of cough or sneeze, you ask him to cover his mouth and nose with either a tissue or a mask and make sure he disposes the tissue and mask immediately and follow hand hygiene. Or the same applies for us also. And if a patient has a acute febrile respiratory tract infection and is coughing and he's in a common area, he's waiting for you to see, what you can do is like at least in the during the waiting time, at least ask him to maintain a distance of about 1 meter away from others. All these guidelines should be displayed to the patients. Environmental cleaning includes a routine cleaning of the areas where it is commonly touched by the patients. For example, when they climb the stairs, they can use the handrails, the common waiting area floor, or the lift buttons. All such common areas needs to be cleaned regularly using some disinfectants. Patient care equipment meaning handle equipment soiled with blood or body fluid secretion using disinfectant before using it on the other patient. Linen handling meaning the linens whichever has been used for a particular patient, handle them with care so that you avoid contact with your clothing or skin directly, okay, with that linen, because linen is also assumed to carry the infection from the patient.